God bless City of Fayetteville. You're listening to Wake Up.
This is Pastor Reginald Johnston of My Father's House Christian Church, and I'm glad to be a sponsor of Wake Up.
If you have been injured in a motor vehicle collision, you should understand that the insurance company is not on your side. It is the adjuster's job to get by with paying you as little as possible. Call personal injury trial lawyer Brent Adams now for a free no-obligation consultation. Call now, 910-888-8888. Don't hesitate. Call 8 at Brent Adams and Associates. We make things right.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome back to another episode of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we're going to discuss an upcoming community event. It is called Step Up for Health and Wellness Expo. We're going to learn how this event has benefited different organizations in the past. And, excuse me, I have had this frog in my throat all morning. And in addition to that, with us today is Cape Fear Valley's Corporate Director of Oncology, Ms. Mary Coolidge. We also have Cumberland County Medical Access Program, better known as CCMAP, with us today, Pharmacy Manager Julia McClellan. And finally, we have the Development Coordinator of Community Engagement from Cape Fear Valley Health Foundation, Ashley Lee. Now remember, we are going to talk about some things that today we may hit on some things that you or your family members may be suffering from or that type of thing. If that is the case, what I want you to do is find yourself a healthcare professional. Do not take matters into your own hands. Well, first of all, ladies and gentlemen, please help me welcome Ms. Coolidge, Ms. McClellan, and Ms. Lee officially to Cape Fear Valley Health's Making Rounds Live. Thank you all for being on the broadcast today.
Thank you for having us.
Now, first of all, Ashley, I'm going to go to you first. Give our audience a little refresher about the community event and a little bit about its history.
Yes, so Step Up for Health and Wellness, formerly known as the Ribbon Walk, has been around for a long time in this community. This year is our third year at Methodist University. It's the Health and Wellness Expo. Step Up for Health and Wellness, it will be April 20th. You can register at 9 a.m. that day. You can register now on our website, and it will last until 12 o'clock. So it starts with a walk, our opening ceremonies, and then we'll do the walk at 10. And follow that with a community wellness expo.
Now, give us an overview of what you've pretty much said. It'll be the walk, it'll be the expo, but let's go into a little more about the expo, because that's my favorite part of a community event. What can our listeners and our viewers expect during the expo?
So during the expo, we do the walk. It's just going to be a really good time for community engagement, for the community to come together with the healthcare system, with Methodist, to be a part of some great education will be happening. We've got so many local vendors. We've got our service lines from Cape Fear Valley doing a lot of education, health education, just different aspects of that. We've got some kid area fun for our little ones, some music. So our Cumulus sponsor, they're our media sponsor. We have Dominique Womack. She'll be our MC that day.
Miss Dominique.
Yes, she will be there. So it's just going to be really fun, community, kid-friendly event. Anyone from the community is welcome. We'd love to have you, as well as it's also students and staff from Methodist, alumni from Methodist University, and then, of course, our staff and community from Cape Fear Valley Health System.
Awesome. And Miss Womack, awesome lady. Awesome lady.
Yeah.
Miss Coolidge, how has Step Up for Health benefited cancer patients in our community?
Omega, there's nothing I like more than talking about how the foundation helps our cancer center patients. The best thing that I want everyone to know is this is our community helping our community. So all the patients that are assisted by any donations or participation in Step Up for Help, that goes straight to your friends and neighbors who are going through the hardship of being diagnosed with cancer. We know this is a difficult journey, so the foundation and the donations go to try to make that a little easier for the patients who have this financial burden. I've worked for the Cancer Center for over 30 years, and there's so many patients that their stories ring through with the donations. One thing is screening mammograms. So our goal is to diagnose cancer as early as possible. But there are many uninsured women who need to have their mammograms, and the funds and donations you make assist. Previously, at least about 200 screening mammograms were paid for through funding. So helping a lot of people who really need the help. Patients who are diagnosed, there are financial burdens that they have to accept, and we need to accept our donations to help them through this journey.
Yeah.
So part of that can be when you're first diagnosed, you might not be able to pay your mortgage payment, your rent payment. One thing that I hear patients say frequently is these utility bills. They've previously been able to pay, but now they have the cancer diagnosis and they need just a little assistance to get them over this bump. So our social workers work with these patients, and through the funding of their friends and neighbors, we assist with utility payments, mortgage payments, and rent. The treatment can cause side effects, and many patients need medications to help at home for their nausea, pain. They may be underinsured, or they may be uninsured, or they may just need little financial assistance with that. So these funds help with that. Also, there's some patients who, while they're on treatment, they cannot meet their nutritional needs just by their food and drink alone, but they need some nutritional supplements. So we help patients get these nutritional supplements to get them through their treatments.
Awesome.
While patients are on treatment, if you have chemotherapy, you can have hair loss, and that can be very traumatic for patients. So we had a very generous donation from the Friends of the Cancer Center to our cancer centers of a cold cap machine, which is a machine that can help lessen hair loss for patients if they would like to use it during their treatment. Yes, ma'am. Wow. And then we also have wig vouchers. A lot of patients would like to get a wig or turbans, hair coverings, and so we have a voucher that will help pay for the head covering of their choice. We also have many medications that are given IV for patients. So that can be very stressful getting your IV started, especially if you have difficult veins. So we did receive a donation for a vein finder machine, which is a machine that the nurses use to help illuminate your veins, which will make it easier for the nurse to start your IV. So we were happy to get that.
That is awesome.
And we also have our newly diagnosed breast cancer patients. Those patients receive at the surgeon's office a bag that is paid through the foundation that has a lot of resources in it that the breast navigator goes over with the patient, and all the resources are in that bag for her at her first appointment for her to take home with her, and also a book about the journey of breast cancer. Many patients have said how much when they got home and opened that bag up and went through it, how much that helps them to understand their diagnosis and to formulate the questions that they might have about it. And another barrier I'd like to talk about is transportation.
Yes.
So transportation can be a hardship. Many people do not own a car, or if they own a car, they might not have the gas to get back and forth for treatments. Our radiation treatments are frequently every single day. Chemotherapy can be weekly, can be twice a week, can be every 3 weeks. But just getting to the clinic can be a barrier for some patients. So if you support the Cancer Center at Step Up for Help, or any donation to Friends of the Cancer Center, that provides transportation vouchers to those patients in need to help them with this one barrier that, as a community, we can work together to overcome.
Ladies and gentlemen, Cape Fear Valley's Corporate Director of Oncology, Mary Coolidge, Cumberland County Medication Access Program, better known as CCMAP, with us today, Pharmacy Manager Julia McClellan, and we have with us today the Development Coordinator of Community Engagement from Cape Fear Valley Health Foundation, Miss Ashley Lee. Now, Mary, are cancer survivors, will they be recognized during Step Up for Health?
We love to recognize our survivors. So at Step Up for Health, one of the most emotional and meaningful parts of Step Up for Health, I believe, is the survivors lab. So during the opening ceremony, all the survivors will be honored during that time.
Awesome. I love that part. All right, Miss Lee, Step Up for Health event, is it strictly limited to cancer survivors?
No, ma'am. So the great thing about Step Up for Health is it benefits 6 different service lines for this event. So you can choose to donate all in, which would go to all 6 different service lines. Or you can gear your donation to go just to one service line, whether it be a service line that has touched you or is near and dear to your heart, or you just want to be a great impact for our community and donate all in. We have cancer as a service line, and we also have 5 others. So we have CCMAP, CAP, we have our pediatrics, cardiac, and then also our nursing education scholarship fund. So there's a lot of different ways to give to this event and a lot of different service lines benefiting from this event.
Ms. McClellan, let's bring you in.
Okay.
I love when you guys are on the broadcast. I was mentioning this during the before we came on. When I'm out in the community, I always have people asking me, are there resources available that can help with medication? The first thing I do is tell them, CCMAP, I don't have any other information, Google them. So let's make sure everyone knows what CCMAP is and what it does.
Okay. So CCMAP stands for the Cumberland County Medication Access Program. If you think of us, we are a safety net for the community. So we're here. It started as a program to help the uninsured patients that were 18 to 64 that were 250% or less of the federal poverty guidelines based on their household size. And as the years went on, we realized that we had a lot of patients that were either underinsured or they were Medicare patients that came to us and they needed a lot of help with their medications. So we're a safety net for our community. So we help Cumberland, Harnett, Hoke, Sampson, Bladen, Robeson County, all the counties that touch us, that we have Cape Fear Valley clinics in. You do not have to go to a Cape Fear Valley clinic to see us or for us to help you with your medication. You can be seen at any other provider's office, but we are basically the hands and feet for your doctor's office. So if you are uninsured and you're 18 to 64 and you come to us, we have a lot of medications that we can help you with, generics and brand names. We apply for medications through the patient assistance programs with the drug companies. And we do a lot of things to help you get the medications that you need so that you can have your conditions under control. So if you have diabetes or hypertension or anything like that, if you can just think of it, COPD, asthma, if they're not controlled with medications, your health is going to get worse, obviously. You're probably going to be going in and out of the hospital. So we're trying to prevent that. We're trying to be proactive, make sure that you are healthier, as healthy as you can be, so that you can enjoy your family, enjoy your friends, be out in the community, and live a healthier life instead of having to be sick and in and out of the hospital. For our Medicare patients, they'll call us and they'll have a medication that they are concerned about because they can't afford the copay for it. So what we do is they don't get fully enrolled. They can apply for anything that they would qualify for through the patient assistance programs with the drug companies. So we ask them questions. So instead of just looking solely at the one medication that they ask about, we ask them what medications they're on so that we can look at the full list and see if there's anything else that we can help them with, because Medicare patients will get into what they call the coverage gap or the donut hole in a hurry if they're on insulins and inhalers and a lot of diabetes medications that are tablets and things of that nature. So we're trying to be proactive to keep them into a place where they can still afford their medications and get those medications free of charge. So we try to be a resource for our entire community, whether they're uninsured or underinsured or somewhere in between, because there's a lot of financial stress that they'll get if they can't afford it. Because some of our patients have to decide, are they going to buy medication or are they going to eat? Are they going to buy medication or are they going to pay their rent? So we're the safety net. And we also try to reach them, point them to resources that can help them if they are in need of something. So if they come to us and we realize they're going to the emergency room all the time or they're going to an urgent care and they don't have a primary care physician, we try to get them to a resource that can help them on a sliding scale fee, because if you don't have prescription insurance, you probably don't have medical insurance. So we're trying to get them to those resources. If they come to us and they say, my tooth is bothering me, we get them to a place that can help them on a sliding scale fee or a place that can pull their tooth. So we try to point them to all the resources in the community that we know of that can possibly help them, to help them as an overall, the best comprehensive way that we can, so that it takes financial stress off of them, it takes emotional stress off of them, and it just helps them to be healthier in the long run. And there's never any charge for any of the medications they get from us or any of our services. We're a completely free program. We're just the hands and feet of your doctor's office to help you get the medications that you need.
All right. Ladies and gentlemen, we are in the middle of a fantastic broadcast about Step Up for Health that's taking place later on this month at Methodist University. And in the studio with us today, Cape Fear Valley's Corporate Director of Oncology, Mary Kulig. We also have Cumberland County Medication Access Program Pharmacy Manager with us, Julia McClellan. And we also have the development coordinator for community engagement from Cape Fear Valley Health Foundation, Miss Ashley Lee. Now, when we return, we are going to talk to Miss McClellan. We're going to ask her to explain how Step Up for Health benefits CCMAP. And she also said something about a donut hole earlier. I want to know more about that. Cape Fear Valley Health's Making Rounds Live. Make sure you stay close.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
This is Pastor Sarah Alford, and you are listening to Wake Up. 3 students from Christ School and all-boys boarding and day school in Asheville were involved in a deadly wreck over the weekend on Interstate 40 near Asheville. 3 girls were also in the car. A boy and a girl were killed. 2 girls are in the hospital. Kurt Telford, the principal at Catholic High School in Charlotte, where those girls were enrolled, told WLOS it's been hard on everybody. For many years, North Carolina's economy depended heavily on textiles and furniture and tobacco. State Senate President Pro Tem Phil Berger says that manufacturing still matters, but it is different. Data from a new report shows teachers are leaving the profession left and right, leaving fewer qualified educators to teach students. A person has been airlifted to an area hospital following a school bus accident in Burke County this morning. The accident occurred on Old North Carolina Highway 10 near Johnson Bridge Road. Bus monitor was apparently taken to the hospital. Mike Rayleigh, NCI News.
I'm Jamie Monticelli, WIDU Radio News. Don't miss out. Join the Fayetteville Police Department for the Women's Open House on April 13th. Explore employment opportunities, including the BLET program, and hear from the women in blue from 10 a.m. until 2 p.m. Mark your calendars and stay tuned for updates. The event will take place at the Police Training Center located at 671 North Eastern Boulevard. The Cumberland County Board of Education has its regular meeting set for tonight at 6. The agenda is up online. The meeting will be open to the public via live streaming on the district's Facebook page. This week, North Carolina welcomes Japanese Prime Minister Fumio Kishida and a delegation of Japanese dignitaries and media members for a historic state visit. The Prime Minister and his wife, Yuko Kishida, will join the Coopers for a state luncheon on April 12th at the Executive Mansion and for several events across the state. The North Carolina trip will follow a White House state dinner hosted by President Biden. From WIDU Radio, I'm Jamie Monticelli.
Some scattered showers are possible during the afternoon. Otherwise, it's mostly cloudy and mild today with high temperatures in the low to mid 70s. Tonight will be mostly cloudy, but a pretty quiet night with lows in the mid to upper 50s. And tomorrow, cloudy skies return with a small chance for rain. High temperatures in the mid to upper 70s. We're watching a thunderstorm threat that returns on Thursday. I'm meteorologist Kat Campbell in the Weather Center.
Over 75 years ago, the Bryan family opened their first dealership in Fayetteville and has been selling Hondas for 50 of those years. From the first days the doors opened, our dedication to quality customer service has never wavered. Whether a new Honda or pre-owned car, van, truck, or SUV, to certified pre-owned Hondas, to service after the sale, are all the reasons why we say nobody beats a Bryan Honda deal. Not now, not ever. So, when considering your next vehicle purchase, come to Bryan Honda or visit BryanHondaFayetteville.com.
If you can no longer work because of illness or injury, you should be collecting Social Security disability insurance benefits. Call Brent Adams now for a free consultation. Don't give up just because you've been turned down. Brent Adams has helped thousands collect full disability benefits even after they've been turned down. Call now, 910-888-8888. Don't hesitate. Call 8. At Brent Adams & Associates, we make things right.
We now return to Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live on the WIDU network, 99.7 FM, 1600 AM. Here's Omega Jones.
Thank you, Ray. Welcome back to the second segment of Cape Fear Valley Health's Making Rounds Live. Before I introduce and bring these ladies back on, I do need to let everyone know that art therapy for cancer patients, you do need to know that it is available they meet every Wednesday from 3 until 4:30 p.m. in the Cape Fear Valley Cancer Center and Cancer Treatment and Cyberknife Center. It's a mouthful. And it's on Owen Drive. And if you want more information, you can call 910-615-4626. Once again, art therapy for cancer patients. I think that is an amazing project that they offer and a program support group that they offer for cancer patients at the hospital. But right now, ladies and gentlemen, we are in the middle of talking about Step Up for Health and Wellness Expo. It takes place later this month at Methodist University. And in the studio, we have with us Cape Fear Valley Corporate Director of Oncology, Mary Kulig. We also have CCMAP Pharmacy Manager with us, Julia McClellan, and we have the Development Coordinator of Community Engagement, Miss Ashley Lee, and she is from Cape Fear Valley Health Foundation. Now, before we went into break, I was talking to Miss McClellan, and Miss McClellan, you used a term called donut hole.
Yes.
I wrote that down because the news in me is like, what does that mean?
Okay.
So explain that to me more than our listeners.
Okay, no problem. So Medicare patients, they get in something called the donut hole. Sometimes you'll hear it called the coverage gap. Basically, it goes off of the cost of the medication that you're getting, not the copay that the patient is paying, but the actual cost of the medication. And so once you reach a certain amount that has been spent for your medications, and it's roughly around $5,000. I'd have to have the exact number. But once the cost of your medication gets to be about $5,000 or so, basically Medicare pays less, and you pay more. And then you have to pay more for a little while until you get out of the coverage gap, which it gets to about $8,000. And then they turn around and they pay more than they were paying in the beginning, and you pay a lot less. But it's that gap that gets everybody that they can't afford it. So you might go in, and the beginning of January, your copay might be something reasonable. It might be $47 or so, and then all of a sudden, you go in the next month to get your refill, and they say, your prescription is going to be $150 today. And then you go, I don't have that amount of money. And so we're trying to prevent that donut hole. So the medications that we get from the patient assistance programs for our Medicare patients, they're not being billed to any type of insurance, so that it takes longer for them to get to that $5,000 threshold. And so we're trying to prevent them from getting to that coverage gap, or at least delay it as best we can, so that they can still get all of their medications at a reasonable rate, if that makes sense.
I'm so glad I asked that question.
Yeah.
All right. Ms. Lee, this question is for you. Or no, I've got to go back. We're talking about CCMAP and how Step Up for Health. How does that event actually benefit CCMAP?
So in a lot of ways, the immediate benefit obviously is that you're getting the word out to the community about what we do and how we can help them. And even if it's not something that they need, they may know somebody that is uninsured, or somebody that's struggling if they have a Medicare patient or something like that, or somebody that's underinsured that they can't, afford their medication. So it gets the word out about what we do. But financially, what we use the money for is to purchase some medications that we are unable to get. So we get medications in a few different ways. One of the ways that we get the medication is through the patient assistance programs, like I've already mentioned. And then we have a program that helps us. We have to pay a fee every year to be part of, and it helps the what's the word I want to use? The patients that are in need in our community. So they get generic medications from generic manufacturers, and we pay to be part of this because it's like a net that goes out across the U.S. to help those people that are underserved. And so that's part of what our money is going to help pay that fee, so that we can order all of the generic medications to help people, so that they don't have to go to Walmart and buy a medication there that they can't afford, or any pharmacy for that matter, because like we were talking about before we started, if you don't have the money for the medication, even if it's a $10 medication, if you don't have $10, you might as well be asking somebody for $1 million. And if you're on multiple medications, and they're having to pay for all of the generic medications that they can't afford, it's a great financial stress. So that helps us to be able to have medications that we get from the patient assistance programs through the drug manufacturers, and then it helps us to be able to have a much wider formulary of medications that we can get for our patients with generic medications. We don't carry everything, but we carry a lot of medications, and if you come to us with a prescription and we don't have that medication, we may be able to say, I don't have that one, but I do have this one that's in the same class or works similarly, something like that. So we have a lot more room to be able to help patients.
That's awesome. Miss Lee, other programs in this event. Tell us about some of the other programs that this event supports.
So this event supports so we have cancer and CCMAP. We also have our community alternative program that helps keep our elder population taken well care of and keeping them out of long-term care facilities. We have our pediatric department. Their service line, I could talk all day for that one. This helps benefit them in many ways. We have an amazing child life specialist on the floor. She helps with our kids on the floor who may just need an extra diversion activity, or just kids who just need a little extra support, whether it be toys or coloring books, crayons, things like that. If there's a scary procedure coming up, the nurses are able to have something as small as a pinwheel just to take a little kid's mind off of a needle prick, or x-rays for our x-ray tech. That's big and scary. So a lot of great things for our pediatric service line. We have bereavement, different bereavement benefits for that also that we don't really talk about too much, but it's a huge part with the foundation and with the pediatric service line, as well as education, lactation services. There are so many different things, car seats, there's so many things, underwear, clothes. There's so many kids that come in with the shirt on their back. So we try to, just understand that they can't accept, they can't control why they are there. Another reason is in an emergency, children or parents don't have time to think about things like that. Our number one priority is to take care of these children. So we kind of reach out to our community for those things, diversion activities and other things like, giraffe beds for the NIC unit, just large and small. There's so many great vendors and so many great sponsors that benefit to our pediatrics. Also, we have our heart care. They do hands-only CPR throughout the community. So they go and educate the community on hands-only CPR, as well as what to do in the case of an emergency like that. So if you have a local organization or a business that you think would benefit from that, that is what this service, our event services for benefits for their service line. Also, we have our nursing education scholarship. They came on this year. That's a big one. That is with obviously our nursing department, and that just helps with clinical ladder and just advancement in nursing education. And so we're thankful to have that here. We've got Castle Uniform. They have sponsored the nursing education scholarship tent. Under their tent, they have lots of fun things planned out for anyone in the community, anybody at the event, kid-friendly activities, just fun games. But as far as benefiting, those are the ones that benefit, and some examples of what your community donation goes to.
It sounds like It sounds like a network. It sounds like a village. It sounds like a circle.
Yeah.
It sounds like a unified team.
I agree. It's really neat to see everyone come together for this. This is my first year leading the efforts, but as far as just being able to say I'm a member of the Cape Fear Valley Health Foundation and reaching out to different local community organizations, corporate sponsors, big and small, it's a blessing to be able to witness and see how great our community is and how awesome if they know that there is a need and what the need is, just awareness. It's awesome to be a part of this. I'm so thankful to be here.
Now, Miss Lee, we just mentioned the network, the team, the circle. So someone listening right now, they're going to be there on the 20th at Methodist University. They want to support more than one organization. Are they limited to one specific organization, or can they spread their love and the support around?
Correct. So they can spread. There's a choice to do all in, and that's divided up between the different service lines. So they can, give to all and come and support us. Or if there is, a sentimental reason or something that, for their personal preference, they can donate to just that one only service line.
Ladies and gentlemen, in the studio, Miss Mary Kulig. We also have Julia McClellan and Miss Ashley Lee on Making Rounds Live, talking about the Step Up for Health and Wellness Expo that's taking place later this month at Methodist University. Miss Lee, I still have some more questions for you.
Great.
All right, now, somebody listening right now or somebody watching, we have this to happen every year. They're saying, I'm not going to walk, I'm not going to run, but I want to attend the event. Do they need to sign up for the race to do that?
Yes, so we would love for you to sign up for the race. We have a virtual option. You can be there in spirit. Just signing up, one cool thing is our Cape Fear Valley Health Auxiliary, Volunteer Auxiliary, sponsored our t-shirts this year. Thank you for that. But you get a t-shirt at sign up. So say you don't even come to the event, you still receive a t-shirt, and they're very beautiful this year, a light Tiffany blue. But so no, you do not have to actually walk. You can just show your support by signing up. A lot of people do that. A lot of our Cape Fear Valley employees are working that day or just in the community, can't be there, but we'd love to have your support also. Our Wellness Expo, you don't have to sign up to attend. That's for the community, and that's just a great way to come and learn about the different service lines of the hospital, some other local nonprofits, as well as our sponsors who help make this event possible. So you can come through that and do that at no charge. The Wellness Expo does not allow sales, so there will be some giveaways and some raffles. Our Health Flex, they are going to do a raffle for visiting certain amount of service expo vendors in the expo center. Mm-hmm. But yeah, you don't have to pay to be there. You don't have to walk. We would love the support, though. Again, this is all benefiting your community, your neighbor. You never know. You never plan to go to the hospital, so you never know what your neighbor's facing next door. You're just being a great asset to our community by supporting either way.
I heard you mention food earlier. Did I hear you mention that?
Yes.
Yeah, I was paying attention. So let's talk about that some more.
Yeah, so
tell us what you have linked up.
Right now, so far, we have the Smoothie Queen is going to return from last year. She will be there. We have Chick-fil-A, our Cape Fear Valley Chick-fil-A is coming up to set up a tent. So she will be serving Chick-fil-A there, as well as their friend, the cow, is coming for our kiddos. We have Lemonades Coffee Company. They will be there. Yummy Hibachi. And then we have Sunset Slush of Fayetteville. It's classic Italian ice.
Wow.
Yeah.
All right. Well, that alone, ladies and gentlemen, should get you to Step Up for Health and Wellness Expo. You mentioned activities for children. I want to mention that. Let's go back to that again, because someone that may be listening just joined us. They may want to go. They may have kids and they're like, I can't go because I don't know if there's anything that's going to be available for my child. So talk to us and tell us about the activities, the special activities for the children.
Yes, so that's a good question. We have, the route is along Methodist campus. It's a 1 mile route as well as a 4K. And it's along the road and sidewalk, so it's stroller friendly. You can bring a stroller, a wagon, whatever you want to push the kiddos if they get tired and need a break. So that's a great question. We'd love to have the kids there. We even offer our t-shirts in youth sizes, so there's t-shirts allowed. It's $25 for kids, $35 for adults. We have kid area, so we're going to have a little kid area. Our nursing education tent, they are going to be doing fairy hair in there, little braids, updos inside, yes, and no charge. So that alone, our Cape Fear Regional Theater, they will be there for our kiddos, and they're going to be doing spin art, some type of spin art there. Our Chick-fil-A cow, and we hope to have some other fun little relay race activities to keep the children engaged, as well as, I think, our Chick-fil-A cow requested a dance party, so we're hoping to have a little dance time.
Okay, the Chick-fil-A cow requested the dance. Okay,
yeah.
All right.
So,
we have a cool Chick-fil-A cow. All right, now people have been asking me, when I'm out in the community, they always ask me about Cape Fear Valley's rolling billboard, and I'm like, rolling billboard? And then it registered, they're talking about the Blood Mobile. So will the Blood Mobile be there, and do people need to sign up if they want to donate?
yes, ma'am. Our blood mobile will be there, but they do not need to sign up. They can walk in and donate as they wish throughout the day. Just bring your blood.
Oh, just bring your blood. All right. And before we close out today, let me ask you this question real quick, because we're talking about the Blood Mobile. How are the donations? Do you know that, as far as or do I need to bring Lindsay in for this? The donations for the blood donors, are we still in urgent need, Lindsay?
Yes, there is a huge shortage for blood, so we need all the blood and all the help.
All right. Now, ladies, I'm going to go around the table and before we close out today's broadcast, and ask you, is there anything about the event, about last year's event, or is there anything that you want to stress to our listeners before I let you ladies go today?
I just like to let them know that it's a wonderful event for our community, so that you can find out a lot of resources that you can find in our community with Cape Fear Valley and other resources as well. So I just encourage everybody to come out, be a part of this day, support your community, and learn some new things that you wouldn't know are in the community that you can either benefit from yourself, or you may know somebody that needs these benefits, these resources. So it's just a great day to come out and enjoy some good weather and some fellowship with people in your community.
And it will be nice that day. We're just going to speak that into existence.
That's
right. All right. All right. Next up.
Omega, it is a wonderful day. From being in the events in the past, everyone has a great time. Methodist College is beautiful. Just being outside at this time of year with your family, I think it would be a great way to spend Saturday, April 20th. Please come by the Cancer Center table that we have. We'd love to talk to you about the services we have at Cape Fear Valley. And please support the Cancer Center. Your donations will be well spent on your neighbors and friends, and everyone in the community will get something from this experience. So I think there's not one single person that would not love being at the event. Highly encouraged.
And I have nothing but praise for Cape Fear Valley's Cancer Center. You guys already know my story. We're not even going to go down that line. And Miss Lee, one thing before I give you the floor, did we forget any vendors? Did we forget any activities that we need to mention?
We have usually about 20 vendors from our Cape Fear Valley service lines, and then about 20 vendors who sponsored the event and are promoting their business, as well as about 15 to 20 nonprofits in the area who are just providing education. It's just a fun time. We can't wait to have it. So the time of the event, our vendors are arriving to set up at 8:30. Registration for the event, so say you registered and you want to come and pick up your t-shirt the day of, you can do that. Say you didn't even sign up and you want to sign up the day of, it's still not too late to come actually the day of the event. So registration's at 9 a.m. 9:30 is our opening ceremonies. We're going to have a lifelink flyover, our helicopter, just a lot of great services happening right there. And then our walk starts at 10 o'clock. And then after that, you come through the expo, and the expo ends at 12.
All right. And give everybody the date again and the location.
April 20th at Methodist University. They're having it there. We're having it there second year, and we're very thankful. We're looking forward to it. If you want to sign up through our Cape Fear Valley Health Foundation website, you can look at it through your social media. Anyway, you can still sign up to register to walk. We'd love to have you. Grab a team. Come on out and enjoy the day.
Awesome. Ladies, thank you so much for being on the broadcast today. It has been great seeing you all.
Thank you for having us.
Thank you for having us.
Thank you so much.
Ladies and gentlemen, once again, Ashley Lee, Mary Kulig, and Julia McClellan on Cape Fear Valley's Making Rounds Live. Step up for health. You still have time to register, as you heard them say. And you can get all the information that you need at cfvfoundation.org. That's cfvfoundation.org. And our next broadcast, go ahead and write it down, April 23rd, which is a Tuesday, of course. And we will talk with the Deputy Director of Rape Crisis of Cumberland County about Sexual Assault Awareness and Prevention Month. So this is going to be a very important broadcast. Please make plans to join us on that day. So, ladies and gentlemen, it's a wrap. For our producers, Shaka Jordan, Ray Thomas, and Miss Lindsey Graham, and the hardworking team that you guys don't even see behind the scenes, I'm Omega Jones, continuing the legacy of Darvin Jones. Thank you so much for listening and watching Cape Fear Valley Health's Making Rounds Live.
Your station for inspiration and information. 1600 AM, 99.7 FM, WIDU1600.com. We are WIDU Fayetteville. WIDU Radio. Follow us on Facebook at WIDU 1600 AM.
NCN News.